Hello, my name is Michelle Mooney, and I am going to provide a unit of instruction for you on the care of a patient with a new colostomy. I have worked in home care for the last 20 years, and I am currently working as a liaison on a medical surgical floor that cares for many colorectal surgery patients. One of my roles is an ongoing challenge ensuring that patients with new colostomies have a smooth transition of care from the hospital to the home environment. Patients need to be set up for success, and that starts in the hospital. Acute care RNs play a critical role in the teaching process for a patient with a new colostomy. Patient education starts on postoperative day 1. Ineffective teaching can lead to delays in discharge, complications with colostomy care post-discharge, and possible emotional anguish for patients or their caregivers associated with problems caring for the colostomy. Due to a high rate of floor turnover, there are many new graduates or new hires that are not familiar with colostomies or their care. They are also not familiar with the important role they have in initiating patient education or the hospital's policy and procedure for doing so. New graduates or new hires will be able to verbalize the required post-op colostomy teaching, including providing the patient teaching packet, showing patient and or their caregiver an instructional video on colostomy care, scheduling every other day appliance changes in the care plan, and consulting a wound ostomy continence nurse and a dietitian. New graduates or new hires will be able to explain the steps for emptying, changing, or troubleshooting a colostomy appliance. New graduates or new hires will demonstrate competency with emptying and cleaning the end of the pouch, performing a complete appliance change. New graduates or new hires will demonstrate the ability to instruct patients on these skills. Review hospital policy and procedure for colostomy care. Low fidelity simulation, including role play. Shadow a WOC nurse during patient education, and WOC nurse to observe new graduates and new hires in providing patient education. It is important for new graduates or new hires to be given an opportunity to practice skills in a simulation where they can apply the new content they have learned before involving a patient. The WOC nurse was chosen for the new graduates or new hires to observe and model due to their wealth of experience with colostomy education. It is also important to develop a relationship with team leaders, as they are a great resource for new RNs to use on an ongoing basis as questions, problems, or concerns arise. Making sure that there is a uniform educational process in place on the unit sets patients and staff up for success.